It's really important to prepare and to visualise the situation and practice with friends or family.
Know what's coming. The information's out there about what the format of the interview is and how you can get points for your portfolio, so you can prepare that a few months in advance.
Make sure you have a practice of how you're going to get to the place, have a practice run of what you're going to do, what time you're going to leave.
But don't be thrown if there's a curveball in the situation. You may not be in a formal conference centre. You could find yourself having your interview in a sports ground, even in a hotel, anywhere where there's sufficient space to interview the hundreds of applicants that they have every year. So don't let this put you off.
You need to leave at least an hour window in case there's traffic or unexpected problems. And some people will even recommend going there the day before, staying in a hotel, really relaxing and making sure you give your interview the best shot.
No one likes being interviewed. It's a pretty stressful time for anyone. And this is where really your practice and your rehearsal period before the interview really comes to the forefront.
And you probably haven't been through an interview process since you went to medical school at least 5 or 6 years ago. So practicing for that is really important, and particularly practicing with colleagues, asking your seniors.
Making every conversation that you have with your registrars and your consultants almost like an interview situation.
Be precise with your answers, don't waffle, give the required amount of information, always answer the questions as well.
Sound really confident, make good eye contact with both your examiners. Don't be afraid to turn to one and then turn to the other.
Keep it nice and structured, be firm, be surgical about it, so give your answers A, B, C, D, E.
And just keep going over lots and lots of different scenarios will make you feel confident and really thoroughly rehearsed by the time you come to your interview.
So in terms of how to present yourself on the day, I think it's really important to wear something you would normally wear, that you're really comfortable in, and obviously which is appropriate for a working day. In general, as long as you feel comfortable, you're wearing shoes you can easily move in, and you're relaxed, then you'll present yourself the best way that you possibly can.
Regarding your body language for the core surgical training interview, it's very important that you be yourself, but also you act confidently. It's important that you are not distracted and you're not fidgeting. So sit back in your chair with your bottom firmly against the back of the seat and have your hands folded in your lap rather than fiddling with any piece of clothing, jewellery, papers in front of you.
So for the management station, you need to not forget that it's worth 1/3 of your marks, okay?
Previously you knew the presentation that you were going to be given, you had as much time to present that, to organise what you're going to say before you said it. And this year you're told on the day what you're going to speak about. Now that in some respects seems very scary because you've got to suddenly come up with things, but you've got to remember that everybody is in that same situation and you're not necessarily at a disadvantage. In fact, you could use it to your advantage. So it's not really about what you're going to say, but it's about the way that you say it and the way that you organise your thoughts.
And in terms of the questions they ask you afterwards, it could be a whole range of different topics. So as long as you have a really clear structure so that you know you can follow the structure regardless of the question, that'll keep you going.
We all make mistakes, and actually feedback and learning from your mistakes is the sign of a good trainee, not just a good trainee, but a good surgeon.
An important thing to always talk about is patient safety, and to always think about an example that you've been a part of in your own practice, and that can make your answer sound much more natural and flow easier.
So my main tip for the portfolio station is to be really enthusiastic. Imagine that these examiners have had a whole day of just talking about people rehearsing their best audit, best presentation. So when you go in, pick your best thing. So I was really proud of this audit because I won a prize. I poured my heart and soul in this so that I organised it, I led it, and then I presented it. And the reason this makes me stand out, and really convey your highlight, convey your best thing that you've done.
So I think the portfolio is really important. It's the first thing that the interviewers will see of you even before you come into the room.
And show it to lots of people, make sure it's very concise, very well organised, very detailed where it needs to be.
Not only in terms of the content of the portfolio, but the aesthetics as well. Spending time getting a nice folder, making it look nice, so just you're presenting yourself really well. This isn't just a correlate of your operative work in terms of you want things that you've done to look really nice, but you're presenting all of your attainments in your career so far. So presenting that in the nicest way possible is a really good thing.
Another really important tip is to make sure there's no patient identifiable data in your portfolio. It's very easy to leave it in there by accident.
I always tell candidates that they should be proud of the things they've done, the things they've achieved, and they shouldn't be afraid to bring their interviewer's attention to that aspect of their career or CV or portfolio.
And finally, you can leave little hidden markers for yourself if there are particular things you're proud of that you will want to talk about, so that you can easily flip open the portfolio and show them off.
So for the clinical station, there are two scenarios. One tends to be an ATLS scenario and the other is a CRISP scenario. The first ATLS scenario, you tend to get outside your station. So you have 3 minutes to read this. So this is the one you can really work on. You can read it, plan your answer, so that when you go in, you sit down, you're confident, and you can read out whatever you're going to say, sound really clear, sound organised. Don't rush too much, pace your answer. Say, I'm going to approach this with an ATLS scenario. I'm going to start with A and then go ahead.
Just make sure you're very, very well prepared. So just run through 10 or 15 different clinical scenarios in your head, and guaranteed one of those clinical scenarios will probably come up. Okay? You want to be slick when you're doing those clinical scenarios. You want to have all the salient points done.
There are always important guidelines, and once you can talk about guidelines, that gives you something to talk about and takes up some of the time, and it will always be in the mark scheme that they're looking for.
Now for your next scenario, they'll give it to you whilst you're in the station. So the best thing to do with this, when you hear it, pause for maybe 2 to 3 seconds, plan your answer in your head so you sound really clear, really rational, and approach it with patient safety in the centre.